Last week, I said we were in a fight with a new enemy, one that is rapidly evolving. The game is changing, and we need to shift our response to stay ahead of this virus. That's why we implemented a province-wide emergency brake to slow the spread of the virus and give us time to get more needles and arms. As I said last week, we're fighting a new enemy. These new variants, they're more contagious, they're putting people in the hospital sooner and for longer. As we confront this new challenge, we'll remain nimble. We will never hesitate to do what's needed to protect the people of Ontario. Over the Easter weekend, I saw the same news coverage as you did. Big groups of people in malls and other retail settings, too many people gathering indoors. I've been meeting with the Chief Medical Officer of Health and the Minister of Health and our entire team over the weekend to discuss the options for how we can address the issues we're seeing in retail settings. Because the situation is rapidly evolving, it's changing day by day, hour by hour, and we need to be ready to adapt as we see issues emerge. And getting ahead of this virus requires action on a few fronts. That means taking action to slow the spread of this virus and getting more needles into the arms of Ontarians. Starting today, Ontario will begin Phase 2 of our vaccine plan, focusing on protecting those at highest risk. Building on the work done to protect long-term care home residents, retirement homes, frontline care workers, and our oldest seniors. We're now moving to protect those with highest risk health conditions and their caregivers. And we will be immediately targeting hotspot postal codes to help get this third wave under control. As we do, we are finalizing plans to vaccinate workers in settings where we're seeing outbreaks. Every single vaccine dose we have in our hands has been allocated to someone who has booked an appointment. And almost all the doses we currently have on hand we received just over the Easter weekend from the federal government has been allocated. The good news is, now that we have received additional supply, we're finally able to dramatically increase pharmacies and expand access to vaccines in primary care. More mass vaccination centers, including those that are paused operations because of the lack of supply, are coming back online. All Ontarians 70 and older are now eligible to book their vaccination appointment by visiting ontario.ca/COVID vaccine or calling 1-888-999-6488. And for all Ontarians 55 and over, we're rolling out vaccinations at more than 700 pharmacies across the province, with more added each week. You can visit ontario.ca/pharmacy COVID vaccine to find a neighbourhood pharmacy that is administering vaccines. This is the largest mass vaccination campaign in our province's history, and we expect to distribute 9 million more doses by the end of June if the supply from the federal government is delivered as expected. If we all stay the course, keep following the public health guidelines, and get a vaccine when your turn comes, there'll be a brighter summer ahead for all of us. Thank you.